from Miami. We have another in the series of Parkinsonism Hangout educational videos, and tonight we have Dr. Rana, a world-renowned Parkinsonism educator, with us. And tonight, Dr. Rana is going to be talking about loss of sense of smell in Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett. I'm happy to be here. Thank you for inviting.
Oh, it's nice for you to be here and continue this series. Let's start off with the first question. How is loss of sense of smell related to Parkinson's?
Loss of sense of smell occurs in about 90% of patients with Parkinson's or so. It is more common in idiopathic Parkinson's disease and is much less frequent in atypical Parkinsonism, such as progressive supranuclear palsy or multiple system atrophy. The loss of sense of smell is usually not seen in vascular Parkinsonism, and patients may have a partial loss of sense of smell or a complete loss of sense of smell, and it may start much before the motor symptoms of Parkinson's disease. And likely this is due to the early involvement of the olfactory system in Parkinson's disease pathology.
Very good. It is seen in younger Parkinson's patients as well?
It could be seen in any patient population with Parkinson's disease, elderly or young. And young patients sometimes may not have complete loss of sense of smell. They may have impaired odor detection, or identification of odor, or discrimination of odor may be a problem. And likely this is related to the lower brainstem pathology, the Lewy body pathology, which is the characteristic of Parkinson's disease. So in the lower brainstem, when the pathology of Parkinson's disease with Lewy body starts, so that could be an earliest stage of Parkinson's disease. Therefore, much before the motor symptoms of Parkinson's disease, patients may start noticing the loss of sense of smell.
Does it affect men and women equally?
This is a very interesting question, and according to some reports, the loss of sense of smell does not show a gender difference, because the Parkinson's disease incidence is slightly more common in men as compared to women. But when it comes to loss of sense of smell, according to some reports, it does not show a difference between men and women. But normally, the sense of smell is better developed in women as compared to men. And whether the changes in the dopaminergic content of olfactory bulb contribute equally to loss of sense of smell in males and females is very difficult to say. It is likely that the loss of sense of smell in Parkinson's disease may not be completely attributed to the loss of the dopaminergic content. The olfactory performance does decline in both men and women after a certain age, around 50 or so. However, in women, this process may start a bit later than men. So the women of the same age, therefore, may be able to smell better than men.
How do you test for it?
Most patients, when you screen these patients, so most patients would report a loss of sense of smell only if you ask them. They may not bring out this information by themselves. So when you start taking history, and when you know that this is a Parkinson's disease patient, so you ask them about loss of sense of smell, partial or complete, when it started, so they would realize that they could not smell things for so long. And sometimes a spouse would say that, oh yeah, he or she could not smell, you know, when food is being made in the house, or you know, certain things for a long period. So it's easy to get that history, because most patients have that. They would endorse this history, although they would not know that this could be related to Parkinson's disease. Usually on examination, so you can test their sense of smell. If you suspect a borderline Parkinson's, or you are suspecting that they may have another condition like essential tremor, and you want to make sure if the sense of smell is gone or at least partially affected. Otherwise, there are some tests which you can do, formal tests. There's a small screening test. It's like a Q-sit test. It's like it asks you to detect 3 odors, and you scratch that thing, and then you sense, and then you tell the examiner, and then you score these patients. Otherwise, there is a very good test developed by the University of Pennsylvania, which is called a smell identification test, on which you can screen the early onset Parkinson's disease patients, or patients who you are suspecting that they could have other condition like essential tremor or so. So you want to test sense of smell. So you can use that test, University of Pennsylvania test.
Is taste affected as well?
The sense of taste is also reported by many patients to be affected in Parkinson's disease patients. The exact cause of this also remains unknown. One of the factors could be that if you can't smell your food, so probably you're not going to be so eager to eat it, or this may contribute to loss of your taste because you can't smell it simply. So otherwise, sometimes this could lead to poor eating, poor nutrition, and weight loss. So yes, it does happen in these patients, but in my own experience, the loss of sense of taste is much less common as compared to loss of sense of smell in the Parkinson's disease population.
Can these problems be treated?
It's a very difficult question, because some of the things or some of the non-motor symptoms which patients have, we can help, but this is such a symptom that it becomes really difficult to explain to the patients that this may not come back, because sometimes they ask that when you would start me on these medication, would my sense of smell come back? So it's quite difficult to answer to them that likely it would not come back, because there's no obvious treatment. At least I've not seen any patients who reported to me that they started smelling better after the treatment was initiated. So basically in these patients, if you don't see other signs of Parkinson's which are obvious, then you could rule out any other pathologies, such as any frontal lobe tumors or olfactory groove, meningioma, or any ENT-related causes such as chronic rhinitis, if you suspect. And otherwise, besides reassurance, we usually don't do much for this type of symptom. The loss of sense of taste is also very difficult to explain to the patients, because it may not come back, and not much treatments are available for these things. So you could rule out maybe cranial neuropathies somehow, or any tumors which may cause these type of problems. But if they have obvious signs of Parkinson's disease, then you understand that it could be related to, it is likely related to Parkinson's disease.
Very good. Is there anything else to add before we close, Dr. Rana, or as far as smell and Parkinsonism, loss of sense of smell and Parkinsonism?
Sometime you would come across patients who would be, although very vigilant about their symptoms, but if they are not aware that loss of sense of smell is related to Parkinson's, so they could make funny comments. I remember a patient. So this was a couple who came, and I was seeing the wife, and so I was going through the routine history. So I said, I asked them about the loss of sense of smell. So the husband, he just popped in, kind of, And he said, well, doc, she has always been like this, she could not smell, and sometimes, food got burnt, and I was the one who told her that, So, but then I tried to take some more information that how long since you have had this problem, and probably he thought that this was unnecessary, questioning I was asking her, and then I was asking about any sinusitis or issues with rhinitis. She said, "Well, doc, we are here for Parkinson's, and then when I did not stop, I didn't realize that, and so I started asking about ENT causes. He said, well, he has already seen the ENT doctors, and she had already seen an ENT doctor. She had a surgery done too. Then what he said? Then said, "Doc, are you not a neurologist?"
Took a wrong turn in the hallway.
Right. So sometimes it happens that so you need to educate patients that this is a symptom of Parkinson's, and this could start much before the other symptoms of Parkinson's disease, and likely it may not come back. And so it's sometimes these type of incidents happen in clinic. The patients they are very focused, and they come kind of prepared that the physician should be focused on the problem on hand, and and we when we ask other things, they feel that we are going out of the boundaries there. So it was quite interesting.
Right. What does that have to do with my problem? What are you talking about? So, okay, Dr. Rana, thank you very much for this summary of loss of sense of smell and Parkinsonism. And this video will be able to be seen at Parkinsonism.tv. So good night, Dr. Rana, and thank you.
Thank you. Welcome.